Hello everyone. Today our experiment of physiology will be about pulse oximetry. In this pre-lab, you'll start with an introduction of pulse oximetry, and you will explain about the aim of this device and the principle of it. Also, how we will apply this device and what are the factors that affect on the pulse oximeter device. First of all, we have an introduction of pulse oximetry, which is a quick, painless, non-invasive method used to measure two things. One of them, the patient's pulse, and the second thing is the blood oxygen saturation, bypassing what? Bypassing a light for tissue. Mostly we use fingertip side for this device, and we analyze how hemoglobin absorbs that blood. So this device or this method depend on the spectrophotometry principle. Oxygen saturation is used to represent the percentage of hemoglobin binding site occupied by oxygen. As we know that RBC have more than 280 million hemoglobin molecule at each RBC. And those molecules consist of two parts, main part which is a pigment and globule protein. And this protein consists of two alpha polypeptide chain and two beta polypeptide chain. Each hemoglobin molecule binds with 4 oxygen molecule or can carry 4 oxygen molecule. The aims of this test, as we said previously, the aim of pulse oximetry is quickly measuring the oxygen saturation, SpO2, and also the pulse rate or the heart rate to detect early sign of inadequate oxygenation. We can see if there is adequate oxygenation in the patient's body or inadequate, and also ensure sufficient oxygen delivery to the body tissues. The principle of pulse oximetry is based on differential absorption characteristic of oxygenated and deoxygenated hemoglobin. As we know that we have two types of blood in our body. We have oxygenated blood and deoxygenated blood or peroxygenated blood. The oxygenated blood mostly present in arteries except pulmonary artery, while the oxygenated blood present in vein except pulmonary vein which contain the oxygenated blood or rich oxygenated blood. We have oxygenated hemoglobin absorb more infrared light and allow more red light to pass through it. This device contains two types of light. We have infrared and red light. The oxygenated blood absorbs less infrared light and allow the red light to pass through it. Whereas the oxygenated hemoglobin absorb more red light and allowing more infrared light to pass through it. As we see in this figure, this is the red light and this is infrared light. As we said that oxygenated hemoglobin absorb infrared light while the oxygenated absorb red light. As we said, pulse oximetry is a method that done by device called pulse oximeter, which is a medical device used to measure the oxygen level of the blood and the heart rate. This figure also shows the principle of working this device, which depend on spectrophotometry method. And we have two type of light in this device, which is red light and infrared light. How to apply pulse oximeter? First of all, as we can say, this is the procedure of using this device. Prepare the patient. We must prepare the patient, ask them to rest their hand on a flat surface without movement, and then we will choose the correct side. We have any side of using this device. Common side, we have index finger, middle finger, or ring finger. We have also alternative sides, maybe air lab or text, especially for infants or babies. The third step, we will attach the pulse oximeter with the finger of the patient. And the fourth step, we must keep the hand still because movement can cause inaccurate reading, and we must avoid the bright light directly on the sensor because our device depends on the light, or their principle depend on light. So we must avoid the bright light directly on the sensor because it's affect to the results. Then you turn on the device, you have oximeter, will detect pulse, and begin measuring light absorption. As we said, oxygenated blood absorb infrared, while deoxygenated blood absorb red light. Then we measure the volume of SpO2, which is oxygen saturation, and their normal range start between 95 to 100%, and the unit of them is percentage. And also the pulse rate will be detected, which is their normal range between the 60 to 100 beats per minute, or BPM. Then we allow a few seconds for stabilization. Mostly wait 5 to 10 seconds for a steady and accurate reading. This is about the procedure of using pulse oximeter. We have factor affecting accuracy of this device: poor circulation. What means by poor circulation? We have cold finger and hypotension. As we know, hypotension when the level of the blood pressure of that person less than the normal. That means the systolic blood pressure less than 90 millimeter mercury, and the diastolic blood pressure less than 60 millimeter mercury. Also, the movement affect on the result of this device. We have nail polish or artificial nails, especially for females. We have another factor, low hemoglobin level, as we see in cases of anemia. We can see low hemoglobin level, and this also affect on pulse oximetry and or pulse oximeter device results. We have carbon monoxide poisoning, falsely increase the SpO2 value, and using pulse oximeter on swollen or injury or infected area may also affect this result. Normal range that can be detected by pulse oximeter. We have at resting SpO2, as we said previously, 95 to 100%, while pulse rate, we can detect it normally between the 60 to 100 beat per minute in adult at rest, when someone do the exercise or activity. After the exercise, the pulse rate increase, and while the SpO2 usually remains normal. Cold hand answer affected the result. We have unstable or low quality signal of the result. Where pulse oximeter are used, in which area we can use, or in which cases we can use this device, in which monitoring respiratory disease like asthma and COVID-19, that they have the respiratory problem during anesthesia and surgery. We can also use this device in intensive care unit or ICU and emergency care, during sleep study or sleep apnea, and during exercise or high altitude exposure. We can use this pulse oximeter. I thank you for your listening. The SpO2 result here we have 98% and the pulse rate 89 pulse rate, and this is our result. We will compare it with normal and we see if it's normal or not. As we see, it's normal.